Yesterday, 230,000 cases of Covid-19 were reported to WHO. Almost 80% of those cases were reported from just 10 countries, and 50% come from just 2 countries. Although the number of daily deaths remains relatively stable, there is a lot to be concerned about. All countries are at risk of the virus, as you know, but not all countries have been affected in the same way. There are roughly 4 situations playing out across the world at the moment. The first situation is countries that were alert and aware. They prepared and responded rapidly and effectively to the first cases. As a result, they have so far avoided large outbreaks. Several countries in the Mekong region, the Pacific, the Caribbean, and Africa fit into that category. Leaders of those countries took command of the emergency and communicated effectively with their populations about the measures that had to be taken. They pursued a comprehensive strategy to find, isolate, test, and care for cases, and to trace and quarantine contacts, and were able to suppress the virus. The second situation is countries in which there was a major outbreak that was brought under control through a combination of strong leadership and populations adhering to key public health measures. Many countries in Europe and elsewhere have demonstrated that it's possible to bring large outbreaks under control. In both of these first 2 situations, where countries have effectively suppressed the virus, leaders are opening up their societies on a data-driven, step-by-step basis with a comprehensive public health approach backed by a strong health workforce and community buy-in. The third situation we are seeing is countries that overcame the first peak of the outbreak, but having eased restrictions, are now struggling with new peaks and accelerating cases. In several countries across the world, we are now seeing dangerous increases in cases and hospital wards filling up again. It would appear that many countries are losing gains made as proven measures to reduce risk are not implemented or followed. The fourth situation is those countries that are in the intense transmission phase of their outbreak. We're seeing this across the Americas, South Asia, and several countries in Africa. The epicenter of the virus remains in the Americas, where more than 50% of the world's cases have been recorded. But we know from the first 2 situations that it's never too late to bring the virus under control, even if there has been explosive transmission. In some cities and regions where transmission is intense, severe restrictions have been reinstated to bring the outbreak under control. WHO is committed to working with all countries and all people to suppress transmission, reduce mortality, support communities to protect themselves and others, and support strong government leadership and coordination. Let me be blunt. Too many countries are headed in the wrong direction. The virus remains public enemy number 1, but the actions of many governments and people do not reflect of this. The only aim of the virus is to find people to infect. Mixed messages from leaders are undermining the most critical ingredient of any response: trust. If governments do not clearly communicate with their citizens and roll out a comprehensive strategy,